Hello dear nursing aspirants, welcome to my channel. So my channel is now Ganesh Nursing Academy. Okay, I have changed my channel from Sri Ganesh Video Lecture to Ganesh Nursing Academy. So as to create an content that is going to help you for cracking the competitive examinations. So today I am going to discuss important MCQs, multiple choice questions on ECG. ECG is electrocardiogram. Okay, so all nursing aspirants, okay, I request all of you to keep a notebook and pen with you. Note all the questions and options what I discuss. Okay, and also note what the important points I will write in the board. What are the important points I will discuss. Okay, if you don't understand, watch the video repeatedly so that you can understand. And I request all of you write notes. Okay, and keep writing the notes as and when you watch my video classes. Okay, as and when I watch my content. Okay, so let's begin with the today's important session, that is a important MCQs on ECG, electrocardiogram. Okay, I have already discussed about electrocardiogram in detail. Okay, that are present in my videos in my channel. If you want, if you are interested to have a comprehensive knowledge regarding ECG, you can watch my all videos which are on the ECG. Okay, so now let us discuss about the important MCQs on ECG. So first question: ECG, electrocardiogram, was first developed by, okay, and the options are William Harvey, option A, option B, Carl Landsteiner, option C, René Laennec, option D, William Einthoven. Okay, so these are the options. First one is option A. Okay, and as and when you read the questions, first one is you carefully read the questions and make down whether there is key points, key highlighting points are there in the questions. You mark it. Okay, make it point. Okay, like a accept. Okay, so all these you have to make it in a make a point, key point in the questions. After reading carefully the questions, now you have to read all the options. Okay, directly you should not jump into the answer. You have to read all the options. So option A is a William Harvey, option B is a Carl Landsteiner, option C is a René Laennec, and option D is a William Einthoven. Now after reading all the options, you first make out the options which are not correct. Okay, so first I will see William Harvey. So William Harvey, is it correct? It is not correct. Okay, because William Harvey is a he has discovered circulation of blood. Okay, so William Harvey, okay, he has discovered circulation of blood, how the blood will circulate in the body. So that is explained by William Harvey. And Carl Landsteiner, okay, is it the correct answer? He has not. It is not a correct answer, because Carl Landsteiner is the one who has discovered about blood grouping. Okay, he has discovered about the blood grouping. Okay, so it is also not right answer. And René Laennec, is it correct answer? No, it is also not correct answer. So the René Laennec is the one who has discovered like a stethoscope. He has invented stethoscope. So he has invented the stethoscope. Okay, and William Einthoven, yes, he is the one. William Einthoven is one who has developed the ECG. Okay, so it is the right answer. So William Einthoven, okay, he is the one who has discovered the electrocardiogram. Okay. Okay, dear aspirants, let's discuss next question. Question number 2. Which of the following specialize in the mass of cell that is known as pacemaker of heart? Okay, that is known as pacemaker of heart. Okay, and the options are AV node, option B bundle of His, option C Purkinje fibers, and option D is a SA node. Okay, so this is very basic questions. Why I have included this question? It is because we have to discuss from easy to difficult. Okay, so we have to cover all the basics about the ECG, and we have to go in depth knowledge about the ECG. Okay, so let's discuss this question. Okay, so this is a heart. Here we have an interatrial septum. It is an interventricular septum. Okay, it is an interventricular septum. Okay. So heart is regulated by 4 specialized mass of cells. There are 4 specialized mass of cells. They will produce the electrical activity. They produce the electrical impulses, conduct the electrical impulses, and help in the excitation or contraction of a heart. What are the 4 specialized mass of cells? That is SA node. Okay, which is located in the right atrium. Okay, this is the left atrium, right ventricle, left ventricle. So SA node which is located in the right atrium just below superior vena cava, and we have a AB node. This is a SA node. This is AB node, and here we have a two bundle branches. Okay, these are the two bundle branches. So they are known as a bundle of his. Yes. Okay, and then we have a Purkinje fibers. Purkinje fibers will spread over both ventricular wall. Okay, so these are the Purkinje fibers. Purkinje fibers. Okay, so these are the four specialized mass of cells. So among these, SA node is the one which produces electrical impulses as an origin. Okay, as an initiator. So that is the reason why SA node is known as a pacemaker of heart. Okay, so AB node, bundle of his, Purkinje fibers, all these specialized mass of cells also produces electrical impulses by their own, but SA node is the one which produces electrical impulses as an origin, and it produces the highest electrical impulses. Okay, it produces electrical impulses at the rate of 100 per minute. Okay, whereas AB node produces electrical impulses at the rate of 60 per minute. It produces 60 per minute, and bundle of is 40 per minute. Okay, it produces electrical impulse at the rate of 40 per minute, and Purkinje fibers it produces 20 per minute. Okay, so 20 impulses per minute. So because of this, SA node is known as a pacemaker of heart. Okay. Next question, dear aspirants. Question number 3. The letters used to denote ECG waves are option A B, C, D, E, option B, L, M, N, O, P, Q, option C is P, Q, R, S, T, U, and option D is J, K, L, M, N, O. Okay. So what letters we use to denote the graphs, the waves in the ECG? Okay. So this is very basic questions. I think all of you know this one. Okay. So is it A, B, C, D, E? No, it's the wrong option. Okay, it's not that. And is it L, M, N, O, P? Okay, it is also not. Okay. And P, Q, R, S, T. Yes, this is the answer for this question. Okay. So let's discuss. Let's draw a diagram. So ECG is denoted by, first one is P wave, which is a positive deflection. Then Q wave is a negative deflection. Again a positive deflection R wave. Then negative deflection. Okay, S wave. And then we have a T wave, positive deflection T wave. Okay. So this is what we denote in ECG, that is P wave. This is Q wave, R wave, S wave, and T wave. Okay. And one more wave is there, that is a U wave. Okay. So U wave is usually, it is not appears, but still we have a U wave. So that is also, usually that is not much significantly appear, but still we consider that is also wave, that is U. Okay, we will denote it as a U. So the letters used to denote the ECG waves are P, Q, R, S, T, U. Okay, P is a positive deflection, Q is a negative deflection, then again R positive deflection, S negative deflection, T and U are a positive deflections. Okay, dear students, let's discuss question number 4. Next questions. Question number 4. Which of the following wave indicates atrial activity? Option A, QRS complex. Option B, T wave. Option C, P wave. Option D, PR interval. Okay. So let us discuss. So what are the waves? I have already told you. We have total P wave. Then we have QRS complex. Then we have T wave. Okay, and U wave. So we have P wave, Q, R, S, and T wave. Okay. So what all this different wave indicates? What activity it will indicates? Let's discuss that one. Okay. So if you can, this is the heart. Okay. So what does this P wave indicates? So this is SA node. This is superior vena cava. Okay. This is SA node. And this is the AV node. Okay. And we have a bundle of his. This is bundle of his, and these are the Purkinje fibers. Okay. So here, what does the P wave indicates here? P wave. Okay. So the P wave, it indicates that the electrical activity has been begin from the SA node. The electrical activity has been begin from the SA node, and activity the electrical impulse is conducted by both atrial chambers and excitation of atrium. So all these indicated. Okay, all the atrial activity is indicated by presence of P wave. If P wave is present, that indicates that electrical activity has begun from the SA node and produced impulses has spread over both atrial chamber and excitation or contraction of both atrium. Then what does QRS complex? What does this QRX complex? Okay, QRS complex. What does this QRS complex indicates? So QRX complex indicates that the electrical activity conducted from SA node to AV node to bundle of his, and then bundle of his to the Purkinje fibers. Bundle of his to this Purkinje fibers. Okay. And then what happens here? There is a contraction of a ventricle. Okay. So what does the QRS complex indicates? QRS complex indicates ventricular. It indicates ventricular depolarization. Ventricular depolarization. Okay. And what does the P wave indicates? P wave indicates atrial activity. It indicates atrial activity. Okay. It indicates atrial activity. And what does T wave indicates? T wave indicates, it is a T wave. What it does indicate? It indicates the ventricular repolarization. Ventricular repolarization. That is a relaxation of ventricles after the contraction. So this T wave indicates ventricular. T wave indicates ventricular. It indicates ventricular repolarization. Repolarization is nothing but a relaxation of a ventricle. Okay. And PR interval. What does PR interval? PR interval is the one which will discuss, which reflects how much time is taken from transmission of electrical impulse from atrial chamber to the ventricular chamber, atrium to the ventricle. How much time the time is been taken to conduct the electrical from atrium to the ventricles. So that is indicated by the PR interval. Okay. So here, which of the following wave indicates atrial activity they have done? Okay, they have asked about the atrial activity. So atrial activity, QRS complex will denote the ventricular activity. It will reflect the ventricular activity. Okay, ventricular activity or ventricular depolarization. It denotes the ventricular contraction. Then T wave. What does the T wave indicates? T wave indicates the ventricular repolarization. That is the relaxation of ventricles. Okay, and this is the one. Okay, P wave is the one which will denote the atrial activity. It denotes that the SA node has begun the electrical activity and electrical impulse is conducted by both atrial chambers and excitation of both the atrium. That is all denoted by the P wave. And what is the PR interval? PR interval denote how much time is taken to conduct the electrical impulse from atrial chamber to the ventricle chambers. That is from SA node to AV node to bundle of his and Purkinje fibers. So this is all about the second question. Okay, dear aspirants, let's discuss about next questions. Question number 5. A nurse is planning to record ECG of patient. Okay, where she do place V2 leads of the machine. Okay, so this ECG machine, it consists of leads. Okay, there are totally 10 leads are there. Okay, and 5 chest leads, 6 chest leads are there, and remaining limb leads 4 are there. Total there is 10 leads are there, which will give information about the ECG of patient. Okay, so where she has to keep this V2 lead. Okay, so this is the key point here. This we have to mark here. Key point where she has to keep the V2 leads. Okay. Option A, 4th intercostal space, right side of the sternum. Option B, 4th intercostal space, left side of sternum. Option C, 5th intercostal space, left side of sternum, mid-clavicular point, mid-clavicular line. And option D is the 5th intercostal space, left side of sternum, anterior axillary line. Okay, so these are the options. And they have asked where she has to place V2 lead. Okay, so first let us draw a diagram. Okay, so this is sternum. This is sternum. Okay, and the ribs arise from the sternum. Okay, okay. So there are totally 12 pairs of ribs are there. Okay. Okay. So in that one, 7 ribs are directly attached to the sternum. Okay. And 3 ribs are 7 ribs are like true ribs, and the 3 ribs are false ribs, and 2 ribs are floating ribs. So totally we have a 7 pair of ribs. So total we have 12 pair of ribs. Okay. True ribs, that is 7, false rib, okay, 3, and floating ribs. Floating ribs are 2. Okay. So we have a clavicle here. Okay, we have a clavicle here. So where to place this one? Okay, and what is this intercostal space? Intercostal space. What is intercostal space? So this is a rib 1, this is a rib 2. Okay, this is rib 1, rib 2, rib 3. Okay, rib 4, rib 5. Okay, so the space between two ribs. Okay, this space, the space between the two ribs, this space, it is known as the intercostal space. Okay, so there are totally 11 intercostal space are there. Okay, as we have told us, there is a 11 intercostal space. Okay, so this is the first intercostal space, this is second intercostal space, this third intercostal, this fourth intercostal space, this fifth, and this is sixth, 7 intercostal space. Likewise, there is a intercostal space. Okay, so when you take a ECG, we have to place leads. Okay, so first leads, where we have to put V1 leads. Okay, V1 we have to place, that is 1, 2, 3, 4. Okay, so V1 we have to place on, okay, it is placed in the fourth intercostal space, right side of the sternum. Okay, this is the sternum, this is the right side, and this is the left side. Okay, so first V1 lead has to be placed in the, okay, fourth intercostal space, right side of the sternum, and V2 we have to place, where we have to place, okay, V2 we have to place fourth intercostal space, okay, left side of the sternum, fourth intercostal space, left side of the sternum. This is the place where we are going to place V2, and V3 will not place now. First we will place V4. V4 we will place fifth intercostal. This is the fifth intercostal place, and this is the clavicle, midpoint of the clavicle. An imaginary line is drawn. Okay, so midpoint of the, that is midpoint of the clavicle, mid clavicular line, fifth intercostal place. There we are going to place the V4. And now V3 we will place exactly between the V2, exactly between the V2 and V4. Here we are going to place the V3. Okay, so initially we will not place the V3. After placing the V4 lead, exactly between the V4 and V2, we will place the V3 lead. Okay, and next where we place the V5, we will place V5 in the fifth intercostal place, anterior axial line. We have, our trunk is divided into anterior axial line, mid axial line, and posterior axial line. Okay, so this is the anterior axial line. We have mid axial line and posterior axial line. So V5 will place in the anterior axial line, fifth intercostal place, anterior axial line. So this is the place of V5. And where we place V6, we place same in the fifth intercostal space, but we will place in the mid axial line. Okay, so V6 is placed in the same in the fifth intercostal space, but a mid axial line. So this is the V6. Okay, so this is all the area where we are going to place 6 ECG leads. Okay, so we are going to place V1 in the fourth intercostal. This is the fourth intercostal space, right side of the sternum. So V2 we are going to place in the fourth intercostal space, left side of the sternum. V3 will not place. V4 will place in the fifth intercostal. This is the fifth intercostal space, mid clavicular line. We will place V4, and V3 is placed between the V2 and V4. Where we place V2 and V4, exactly midway between this, V2 is placed, and V5 is placed again in the fifth intercostal space, anterior axial line. Okay, and finally V6 is placed in the fifth intercostal space and mid axillary line. Okay, so as a nurse is planning to record ECG of a patient, where to she place V2 lead? Okay, V2 lead of the machine. Okay, is it fifth intercostal space, right side of the sternum? Okay, here it is a we are going to place V1. It's a wrong option. Okay, it's a wrong option. Fourth intercostal space, left side of sternum. Yes, so this is the right answer. Here V2 we are going to place fourth intercostal space. Okay, left side of the sternum. Okay, fourth intercostal space, left side of the sternum. It is a right option. Okay, and fifth intercostal space, left side of the sternum, mid clavicular line. Okay, so here we are going to place a V4. Okay, we are going to place V4 in this one. Okay, it's a wrong option. And fifth intercostal space, left side of the sternum, anterior axial line. So this is the one where we are going to place V5. Okay, it is also wrong option. So right option for this one is fourth intercostal space, left side of the sternum is the right answer, where we place the V2 lead. Okay, so I hope all of you understood this. Okay, dear students, let's discuss next questions. Okay, question number 6. Duration of small squares in ECG strip is 0.08 second, option B 0.12 second, option C 0.10 second, option D 0.04 second. Okay, so when you record the ECG, so ECG graphical representation will be recorded in the ECG strip. Okay, and in the ECG strip there will be squares will be there. Okay, there will be small squares and large squares. Okay, so this is a large square. Okay, taking an example, this is a large square. So each large square have a small squares. Okay, so this is a large square and this is a small square. Okay, so there is a large square and a small square. Okay, and what is the duration of small square? The duration of this small square, the duration of this small square is 0.04 second. Okay, so here the option what they have given is 0.08 second. It's wrong. Okay, option B 0.12 second. It is also wrong. Option C 0.10 second. It is also wrong. Option D 0.04 second is the right option. Okay. So what is the duration of small squares in the ECG strip? It is a 0.04 second. Okay. In the same way, if they ask what is the duration of large square, what is the duration of a large square? Okay, large square or large box. Okay, what is the duration of large box in ECG strip? Okay, in that one, the duration of large square is, it is 0.20 second. Okay, there will be total, see here, 1 2 3 4 5. Okay, so there are totally 5 squares are present in a large square. So this is a large square, this is the large square in the ECG strip. Okay, so in this large square there are totally 1 2 3 4 5 small squares are present in the one large square. So that is nothing but a 0.04 into 5. This is nothing but a 0.20 second. Okay, so what is the duration of large square in ECG strip is, it is a 0.20 second. Okay, so option A, option B, option C are wrong options. So option D, that is 0.20 second. So the duration of small squares in ECG strip is 0.04 second and duration of large square in the ECG strip is 0.04 into 5. That is a total 5 squares, small squares present in the large box. So it is a 0.20 seconds. That is the duration of a large square in ECG. Okay, so this is all about the basic of a ECG. Okay, dear aspirants, let's discuss next question. Question number 7. Okay, which of the following are component of ECG interpretation? Okay, so whenever we take ECG of patients and when we get ECG in our hand, okay, what are the interpretation components which will help you to interpret or understand the ECG very well? Okay, so options are, option A rate, option B rhythm, option C conduction, option D is a configuration, and option E is a all of the above. So whenever we get a ECG strip in our hand, so we have to filter the ECG. We have to try to interpret the ECG by using what are the components. First we have to assess the rate. Okay, so rate is a right here, that is we are going to assess the atrial heart rate and we are going to assess the ventricular heart rate. Okay, so next rhythm. Yes, rhythm is also one correct one because we are going to assess the atrial rhythm and ventricular rhythm. So both rhythm we are going to assess in the rhythm. And conduction, yes, we are going to assess the conduction also. What we are going to assess the conductions? That is the duration, that is PR interval, QRS duration, QT interval. Okay, QT interval. So all these interval durations we are going to assess in the conduction. And what is the configuration? So configuration means we are going to examine all the waves, okay, morphology in the ECG. That is how does the P wave, okay, how about the QRS complex, okay, QRS complex, and we are going to see ST segment, we are going to see T wave. Okay, so all these waves are individually assessed, okay, assessed, okay, and studied in the configuration. So here the component of ECG interpretation are all of these are the components of ECG interpretation. So answer for this one is all of the above. Okay, what is the answer for this one is all of the above. Okay, So we are going to interpret the ECG by using the components like rate. In rate we are going to assess atrial heart rate and ventricular heart rate. We are going to use the rhythm. In rhythm we are going to assess the atrial rhythm and ventricular rhythm. Okay, and conductions we are going to assess the conductions. In conduction we are going to assess the PR interval, QRS duration, QT interval, and we are going to assess the configuration. In configuration we are going to assess what is the morphology of P wave. Okay, what is the morphology and appearance of QRS complex. Okay, ST segment and T wave. Every waves are individually studied in the configuration. So these are all the components of ECG interpretations. So option D, that is option E, is all of them is the right option here. Okay, dear students, let's discuss next questions. Question number 8. Which of the following method is used to assess heart rate in ECG strip? Okay. See here, after taking ECG of the patient, when you get a ECG in our hand, we can assess the heart rate of the patient by looking at the ECG of the patient. Okay. So you may ask how it is possible, how we can do it. So we can assess the heart rate in ECG strips by two methods. What is that method? Is 1500 method. Okay, 1500 method, and another one is sequence method. So here we are going to assess the heart rate. Okay, we are going to assess the heart rate of patient, that is atrial heart rate and ventricular heart rate. Okay. Now how to assess atrial heart rate and ventricular heart rate? Okay. So first one is, this is a P wave, this is a QRS complex, this is a T wave, again this is a P wave, QRS complex, this is a T wave. P, Q, R, S, T, P, Q, R, S, T. Okay. So when you want to assess first atrial heart rate, so if you want to assess the atrial heart rate, what you have to do? We have to mark, okay, where the P wave is, exactly midway in the P wave, we have to mark between two consecutive P wave and just count the number of small box. How many small box are present? Okay, like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Okay, like that. So what we have to do? We have to just mark between two consecutive. If you want to assess the atrial heart rate, just mark on the P wave, two consecutive P wave. Okay, and count the number of small box. Okay, suppose if you get a small box, that is 20. So you have to divide it. Okay, 1500 divided by number of small box. Okay, so that will give us about 75 heart rate per minute. So this is the assessment of a heart rate by using 1500 method. Okay, suppose you want to assess the ventricular heart rate using 1500 method, means you have to just mark. Okay, just mark here between two consecutive R wave. Just mark between two consecutive R wave and count the number of small box. How many small box are present between two consecutive R wave? Okay, so if you get a number of small box, okay, number of small 1500 we have to keep constant, and number of small box between two consecutive R wave, if you get a like a 20. So again the ventricular heart rate is 75 per minute. Okay, so here ventricular heart rate and atrial heart rate is 75 per minute by using 1500 method. Okay, now let us discuss about the sequence method. So another method of assessing the heart rate is sequence method. Now we wanted to assess the atrial heart rate and ventricular heart rate using the sequence method. Okay, second method. So in this one, this is a P wave, this is a QRS complex, and this is a T wave. Again we have P wave, QRS complex and T wave. So P, Q, R, S, T. P, Q, R, S, T. Okay. So here we wanted to assess the atrial heart rate and ventricular heart rate by using sequence method. So in this sequence method, what you have to do? See here, if you want to assess the atrial heart rate, always you keep it in your mind that whenever you wanted to assess the atrial heart rate, you have to mark between two P wave, two consecutive P wave, and whenever you want to assess the ventricular heart rate, you have to mark between two R wave. Okay, two R wave. Now I wanted to assess the atrial heart rate by using sequence method. Sequence method means I will just count how many large boxes are present between two consecutive P wave. Okay, so this is one large box, 2, 3, okay, and 4. So totally 5 large boxes are present. Okay, so first large box I will count it as a 300, heart rate as a 300. Second large box I will count it as a 150. Third large box I will count it as a 100. fourth one I will count it as a 75, fifth one I will count it as a 60. Okay. If there is only one large box is present between two consecutive P wave, heart rate will be 300. If two large boxes are present, heart rate is 150. Okay, three large box, heart rate is 100. If four large boxes are present, heart rate is 75, and five large boxes are present, that heart rate is 60. So likewise, if you want to calculate ventricular heart rate, count. Okay, see how many large boxes are present between two consecutive R wave. Okay. Okay, first if box will read it as 300, heart rate is 300, then second box will be counted as 150 heart rate, then third one is like 100. Okay, fourth box is present, if present it is the 75 heart rate, fifth means 60, sixth means 50, heart rate is 50. Okay, so here we will count as a 300, 150, 100, 75, 60, 50. So heart rate, ventricular heart rate is 50. So here 300, 150, 100, 75, 60. So only 4 boxes are present here. Okay, only 5 boxes are present here. So heart rate is 60. Here 6 large boxes are present here. So heart rate is 50. So this is the way we are going to assess the heart rate. Okay, both atrial heart rate and ventricular heart rate using 1500 method and a sequence method. Okay, so here which of the following method is used to assess the heart rate in ECG? Okay, we are going to assess the 1500 method, that is also correct. We are using the sequence method, that is also correct. So both A and B we are using, that is the right option. Okay, so here the option is, that is option C, both A and B is the right answer. Okay, and none of the above is the wrong option here. Okay, so we use both 1500 method and the sequence method. Okay.